During this orientation, we will take a short look at the nonprofit sector, cover some basic information about the Partnership Health Center, and look at your role as a board member. First, let's look at America's 3 sectors. The private sector includes business and industry. The public sector includes government and the public education systems. The nonprofit sector includes charitable organizations, membership associations, and professional societies. The IRS defines different types of nonprofits in its tax code. Charities such as Special Olympics, the YMCA, and the Metropolitan Museum of Art are described in Section 501c3. Professional and trade organizations such as the American Dental Association, AARP, and the National PTA are described in Section 501c6. National social welfare organizations such as NAACP, National Organization for Women, Sierra Club are described in Section 501c4. Social organizations such as swimming clubs, garden clubs, alumni associations are described in Section 501c7. The nonprofit sector is comprised of approximately 1.6 million nonprofit organizations in the U.S. In 2017, the total assets in charities totaled more than $2 trillion. Nonprofit jobs accounted for 10.3% of all U.S. private sector employment in 2012. About 25% of Americans volunteer for nonprofit organizations. Combined contributions totaled $370 billion in 2017. In 1995, a group of individuals representing various companies and organizations began meeting and discussing the increased cost of healthcare and possible solutions. Leading this group were representatives from Public Health, South Georgia Medical Center, Valdosta State University, the Langdale Company, and Georgia Power. In early 1996, a stakeholder meeting of area businesses and agencies was held to discuss forming an organization to address community healthcare issues. This group unanimously voted to create the Lowndes County Partnership for Health, whose name was changed in 2018 to Partnership Health Center. The organization was incorporated in July of 1997. Soon after its incorporation, the organization conducted a community health needs assessment. The results led the board of directors to apply for and receive a 3-year federal grant to create cardiovascular disease prevention programs in businesses, churches, and schools. Through additional funding, the Well Workplace program was launched in 2001 with 15 participating companies. The success of this program led to the creation of a fee-based disease management program in 2007. This program continued until 2015. In 2002, another 3-year federal grant was awarded to address diabetes prevention in primarily African American churches. As a result of this grant, the MedBank program was created in 2003 to collaborate with pharmaceutical manufacturers to provide free and low-cost medication to the area's uninsured. This program continues to expand and grow and has, to date, provided medication valued at over $37 million. In 2004, the Partnership Cancer Fund was founded to assist local cancer patients with the cost of medication, transportation to and from appointments, and nutritional supplements. This program was divested to the South Georgia Medical Center Foundation in 2016. 2005, the board of directors began discussions about opening a medical clinic that would serve the uninsured residents of Lowndes and the surrounding counties. These discussions led to the opening of the Partnership Health Center in 2007. Since then, the Partnership Health Center has continued to grow with the assistance of generous funding from South Georgia Medical Center. The clinic has served almost 7,000 patients. In 2019, it provided over 21,000 patient visits. In 2015, the Partnership Health Center opened a dental clinic through the efforts of the late Dr. Bill Broadfoot and Dr. Joe Curbo, who still volunteers. Dental care is provided through the generosity of volunteer dentists, hygienists, and dental assistants. A vision statement reflects the impact of the organization in the years to come. A mission statement guides the organization in working toward fulfilling the vision. The vision of the Partnership Health Center is healthcare for all. Its mission is delivering medical and dental care to South Georgia's uninsured. Our major funder is South Georgia Medical Center, which provides approximately 88% of our funding. The four major goals of our current strategic plan are: maximize primary care services, build organizational capacity to deliver health and dental care, implement a sustainable financial model, expand the dental care program. Our key relationships are with South Georgia Medical Center, local physicians and dentists, churches, other nonprofits, the Chamber of Commerce. Sources of income include foundations and grants, individuals, companies and businesses, and patient fees. The Board of Directors is composed of up to 30 members who serve 3-year terms. Currently, there are 19 members. A maximum service of 2 consecutive terms is allowed. The Governance Committee leads the recruitment and nominating process. The following is a list of documents that each board member should read. These documents are found in the boardable software. Bylaws, policies and procedures, the most recent audit, the current fiscal year's budget, the most recent annual report, the current strategic plan. The following list are the current board officers. The following list are the current board committees and their chairs. There are 3 key roles for the board: set organizational direction, provide oversight, and ensure the necessary resources for the organization. Each of the key roles has associated with it a series of specific board responsibilities. Now let's look at setting organizational direction. Board members are responsible for participating in regular strategic planning, determining the organization's mission, setting the vision for the future, establishing organizational values, setting major goals and develop strategies, approving operational or annual plans. The board's oversight role is perhaps one of the most important roles. Responsibilities under this role include overseeing the organization's financial health, which includes reviewing and approving the budget, reviewing the annual audit, and overseeing the organization's investments. Minimizing the organization's exposure to risk, which includes ensuring that the organization has the proper insurance, adopting a risk management policy and proper human resource policies, and safeguarding the organization against any unnecessary risks. Measuring progress on the strategic plan, which includes ensuring that the organization is applying the goals and strategies in every activity. The board is also responsible for ensuring that the organization complies with federal, state, and local laws, that it develops appropriate organizational policies, and that it adopts a code of ethics for both board and staff. The board should annually evaluate the performance of the chief executive and assess its own performance approximately every 2 to 3 years. Resources are defined as both human and financial. In addition to hiring the chief executive, the board is responsible for ensuring that the organization has the financial resources with which to operate. That includes adopting appropriate fundraising policies, supporting the organization's fundraising activities, and developing alternative funding sources, such as fee-for-service programs, investments, or for-profit ventures. The board is also responsible for promoting and protecting the organization's public image by maintaining good relationships with other organizations and with stakeholders, and ensuring that the actions of the organization and its board are guided with integrity. The board needs to look at itself as a strategic resource for the organization. It should periodically look at its composition and structure and make the necessary changes that best serve the work of the organization. Board members are held accountable to the organization by law. Under well-established principles of nonprofit corporation law, board members must meet certain standards of conduct in carrying out their duties to the organization: duty of care, duty of loyalty, and duty of obedience. Each board member has the following responsibilities: participate in the governance of the organization by attending 66% of the board meetings throughout the year. Participate actively on one committee by attending 66% of its committee's meetings throughout the year. Make a personal financial contribution each year to the organization so that board achieves 100% personal giving. Manage 2 to 3 relationships that result in support for the organization. Each board member can help the organization by providing names of potential donors and visiting with donors, writing thank you notes or making thank you phone calls, attending fundraising events, acting as a resource to the CEO, volunteering, which helps you to understand the organization and build a positive organizational culture. In summary, as members of the governing body, you have a responsibility to the duty of care, the duty of loyalty, and the duty of obedience. You have ultimate responsibility for the organization, but only during board meetings when developing policy and acting collectively. In addition to the board's collective responsibility, each board member has individual responsibilities to the organization. Board members should be active participants in the governance of the organization. That means that board members should show up for meetings, read board materials, stay informed, and be ready to participate in making decisions on behalf of the organization. The work of the board doesn't stop at board meetings. Board members should also serve on board committees and task forces. Outside the boardroom, board members should be active community ambassadors, promoting the organization's mission, service, and achievements, as well as bringing community perspectives to the attention of the board and staff. In conclusion, you probably have many questions, but we hope they will be answered as you progress as a member of the Board of Directors. We are excited about your participation on the board and hope that it is exciting and rewarding for you also.